Today I'll be clearing some of the doubts relevant which are related to most common inflammatory diseases which are very much prevalent in society nowadays, but people are still very much unaware. So the first and foremost is lupus. So lupus is basically an autoimmune disease in which our immunity system gets dysregulates. So the function of our immune cells is to work in favor of our own body, that so that we don't get any kind of infections very easily. But sometimes what happens is in diseases like lupus and some other autoimmune diseases, our own immune system works against our own body. So our immune cells like T cells and B cells, they make such kind of antibodies in our own system so that it starts harming our own organs like kidneys or heart or joints and things like that. And that's when we call it as lupus. Lupus has various presentations. So what kind of organ or system of the body is involved, it depends accordingly. Like if only skin is involved, there can be acute cutaneous lupus erythematosus or lupus erythematosus or discoid lupus, depending on the pattern of skin involvement. Or if there is kidney involvement, we can say it as lupus nephritis. Or if there is only vessel involvement, we can say it lupus vasculitis. Or if brain involvement is there, we can call it as lupus cerebritis. So it's just one single entity, lupus, which is a multi-system disease. So it can involve any of the systems of our body, like skin, liver, kidney, brain, blood vessels, lungs, heart, any of these systems. So depending on that, yes, we can categorize. And depending on the severity, we can say it's a mild grade or a moderate grade or a very severe grade. But there are no different types of lupus as it. Lupus is just one single entity. Our immunity system is very much regulated by our own hormones. So lupus, also known as SLE, is very common among females, especially in the fertility age group. That is from like 18 to 45 years of age. So in that age group, our hormone systems, they are changing, like before menopause and after menarche. So that's when, because these hormonal dysregulation, the antibodies formation occurs in our body. Then a lot of females from the young age itself, they are very obese. So obesity is also one of the risk factors. There are a lot of hereditary factors which are involved. So if any of the family members has lupus, then yes, there are chances of their siblings or their daughters and tend to have lupus. Males as such have very less tendency of developing lupus. Plus there is a lot of ethnicity also. So Asian people tend to have more incidence of lupus as compared to Western population. If you have symptoms like photosensitive rash, if you go out in sun and this area specifically, this becomes very red and inflamed and becomes itchy, it's called photosensitivity rash, also known as malar rash in lupus. Or if you have a lot of oral ulcerations, or if your hair are very brittle, they keep falling on its own, and there's baldness, bald patches here and there, and or any kind of very itchy rash, or different kind of rashes are there in the skin, or if you have joint inflammation, like joints become tender and swollen, or early in the morning if you get up you feel a lot of stiffness in the small joints of hands, or you have a lot of tendency of headache, like migraine like episodes, and along with other features. And someone can have sudden onset of pedal edema, like there'll be swelling in both feet if they are standing for a long time with some red spots. Then in that case, yes, that could be a sign of early kidney involvement. So if any of these features, but they are not very specific, like someone can have only fever. Fever is like persistent for very long time, and someone can have recurrent abortions. Someone can have just skin changes. Someone can have kidney involvement along with skin changes. So it depends which system is getting involved. But yes, these are the most common symptoms, and especially females, young females are having any of these symptoms, then they should go and see a rheumatologist or a physician nearby. And then the common test which is done is anti-nuclear antibody, which is ANA. which is done, and a good examination should be done by a rheumatologist, and that's how we can diagnose the person as having lupus. Lupus is a multi-system disease. It affects almost all the systems of the body from tip to toe. So it does affect brain, in which if it's mild, you can have just severe headaches, migraine-like headaches. Someone can have seizures. If there's vasculitis or thrombus formation, you can have paralysis, paralytic attack sort of things. There can be eye involvement leading to retinitis or uveitis, or sometimes blindness if there is nerve involvement. Then there can be lung involvement, in which lung tends to get fibrosed, or ILD-like condition can happen. Kidney involvement is very, very scary in lupus. So if there are any symptoms of kidney involvement in lupus, or you are losing protein in your urine, then yes, it needs to be evaluated as early as possible, and treatment should be very aggressive, because kidney, if you go up, there's staging in kidney involvement. If you go up to stage 5, then getting back to normal is it is possible, but it is tough. So yes, that's how different any body part or any system of the body can get involved with lupus and needs treatment accordingly. Lupus has got really, really good treatment options. Initially, it used to be only steroids, but yes, now there are a lot of medications which are there. There are a lot of biologicals which are available, and still a lot of them are in the pipeline on research. So there are good medicines as well as biologicals which are available depending on the system involved. But yes, if target organs are involved, like if your kidney is involved, or brain is getting involved, or lung is getting involved, then treatment has to be very, very fast and very, very aggressive, and has to be seen by a rheumatologist, because if these organs, any of the organs get damaged, then chances or the prognosis is really bad. So earlier the diagnosis and faster the treatment, better is outcome. So as I already mentioned, the very risk factors for developing lupus in any of the females is, first is hereditary, then is obesity. Then if a girl is not attaining MENARC at an early age, if there is no physical activity, or if a person is doing a lot of smoking or taking a lot of alcohol, eating a lot of junk food, then yes, there are chances of developing lupus in such patients. So they should be very much vigilant about their health. They should follow a good balanced diet, and always do regular exercises. Check on your weight, and if any of the symptoms related to lupus you feel that you can have lupus, then you should be seeing a rheumatologist as early as possible. If you already have lupus, you're diagnosed as lupus, then the first and very important thing is, please don't get misguided by going into Google or taking wrong information from here and there. You should always consult your rheumatologist and trust on your rheumatologist for whatever they say. The important things which you should follow is take your medicines properly and visit your rheumatologist regularly. Sun exposure should be avoided at any cost, because UVA rays in the sun is the one which increases the ANA activity and increases the skin manifestation as well as the disease. So sun exposure is really, really bad, and you should always use good sunscreens while going out in the skin. Always use an umbrella or cover your exposed areas when you are out in the sun. Then you should definitely avoid smoking. Alcohol once in a while you can still have, but it's better if you avoid that as well. And if you are into a conceiving age group, like you want to conceive, or like for pregnancy purposes, then yes, you should consult your rheumatologist if you are already on medication, because your medications need to be revised. But yes, definitely you can still conceive. So it's just a revision of the medicines which is needed, and always have good, healthy lifestyle in a way of balanced diet and regular exercises, and keep a good check on your weight. As well as osteoporosis is very common in lupus. So bones tend to be very fragile and easily fracture. So eat good high calcium and high protein diet.